Hey everyone, and welcome. When people hear the term IVF, they probably picture this one single straight road. But the truth is, it's actually more like a map with all these different routes that can lead to the same beautiful destination. Today, we're going to explore that map together. So, that really gets to the heart of it, right? Is IVF just this one-size-fits-all thing? Well, spoiler alert. Nope, not at all. It's a super personalized journey, and understanding all your choices is really the best first step. So, let's dive in. Okay, so the first big fork in the road is basically deciding on your starting line. You've got two main approaches. Stimulated IVF, which is probably the one you've heard the most about, and then there's its gentler counterpart, natural IVF. Okay, so the main difference is pretty simple. Stimulated IVF uses medications to, well, stimulate your ovaries so they produce a whole bunch of eggs at once. Natural IVF, on the other hand, just works with that one single egg your body prepares naturally, on its own, every single month. So you might be wondering, why would anyone choose the path with just one egg? Well, for starters, it's way gentler on your body. You get to skip a lot of the side effects from those hormone injections, and it basically gets rid of the risk of a pretty serious complication called ovarian hyperstimulation syndrome, or OHSS for short. And hey, less medication also means it costs less. And this is where the big trade-off comes in. While natural IVF is definitely less invasive, the reality is that having more eggs from a stimulated cycle just gives you more shots on goal, so to speak. It creates more opportunities to find a healthy embryo, which, can boost your chances of success for that particular cycle. All right, so once the eggs are collected, doesn't matter if it's one or a whole bunch, they're off to the lab. And this is where things get really cool, where all this incredible technology starts to work its magic to help create embryos. So one of the star players here is a technique called ICSI. Instead of just, putting egg and sperm together in a dish and crossing your fingers, ICSI is way more direct. An embryologist actually picks out a single, healthy-looking sperm and injects it right into the egg. It's like giving fertilization a personal helping hand. Now, ICSI isn't always needed, but wow, it is an absolute game changer in some cases. It's a really great option if there are male infertility issues like a low sperm count. It's also a go-to if a past IVF cycle didn't work out, or when you're working with really precious eggs, like ones from a donor. Okay, so you've got embryos. The focus totally shifts now. The next big goal is finding that one little embryo that has the very best shot at becoming a healthy pregnancy. And one amazing way to do that is with something called pre-implantation genetic testing, or PGT. Seriously, think of it like checking the embryo's genetic blueprint before you build the house. Around day 5 or 6, a few cells are carefully removed and tested. This helps the team pick an embryo that's chromosomally normal, which can really increase the odds of success. Okay, so that leads us right into the next big decision: timing. Do you put the embryo back right away in what's called a fresh transfer, or do you freeze it and plan the transfer for a later frozen cycle? I know, this can sound a little weird, right? Like, if you have this perfect little embryo ready to go, why on earth would you wait and freeze it? Turns out there are some really good reasons. First off, a frozen transfer lets your body just chill out and recover from all the stimulation meds, which helps create a much more natural, welcoming home for the embryo. It's also what gives you the time to get those PGT results back. For a lot of people, letting their body reset before the transfer can actually mean higher success rates. And even within those stimulated cycles we talked about, it's not like there's just one recipe. The medication plan, what doctors call the protocol, is totally customized for you, based on things like your age, your overall health, and how your doctor thinks your body will respond. Yeah, think of it like doctors having a bunch of different recipes they can choose from. So for instance, there's the antagonist protocol. It's shorter, and it's often a safer bet for someone who might be at risk for OHSS, because it gives the team more control. Then there are other protocols that might be better for someone with a lower egg reserve. It's all about finding the perfect fit. And really, all these personalized steps, all these choices are about one thing: maximizing your chances of success. I mean, just look at the numbers. A less invasive treatment like IUI might have about a 15% success rate per try. But with IVF, because it's so much more hands-on, that number jumps to around 40%. That huge difference is why so many people choose this path. Sometimes the journey to building a family involves a little extra help. So let's talk about another really important path on this IVF map: using donor cells. This can be such a wonderful and necessary option for so many people. There are so many reasons why someone might choose to use donor eggs, sperm, or even embryos. It could be because of age-related changes in egg quality, severe male infertility, or to make sure a genetic condition isn't passed on. And of course, it's an amazing and vital option that helps same-sex couples and single parents build their families.
Okay, let's zero in on a question that can feel really heavy. What happens in cases of severe male infertility, where a test comes back showing no sperm in the sample at all? I mean, for a lot of people, that can sound like the end of the road.
But this is where modern medicine is just incredible. Get this, even if there's no sperm in the sample, it's often still being made inside the testicles. A simple surgical procedure can retrieve that sperm, and then it can be used with ICSI to fertilize an egg. It's a total game changer that opens a door that honestly seemed locked shut. So, when you look back at everything we've talked about, from natural cycles to ICSI to all the donor options, the one thing to really remember is this. IVF is not a single road. It's a personalized map drawn specifically for your journey. So, we'll leave you with this question. As you think about your own path, what part of this fertility map are you most curious to explore next? Because getting informed, getting curious, that's always the best next step you can take. Okay, and before we sign off, we have to say something really important. Everything we've chatted about today is just for educational and informational purposes. It is absolutely not medical advice. Please, for any personal questions, always talk to your doctor. And hey, if you want to dive deeper and get more info on the whole IVF process, you can find a ton of great resources over at the IVF From Me portal at ivfforme.com.